welcome back to an Ode To Birth podcast. Today we have Dr. Taylor Bean.
Thank you for having me. It was great to be here.
I literally have the most burning question for you. I have been dying to talk to this woman literally for like years. Like low-key fangirling right now.
Well, don't. I'm really happy to be here. Yeah. Anyone that gives me the space to speak, I'm really honored to be here. Yeah.
Beautiful. The biggest question I'm getting right now from clients is around the T-dap vaccine. So when they're pregnant, and please, I know nothing. I'm so green. I've been just sending them to you when it comes to these questions.
Yeah.
Childhood immunizations, inoculations, and in pregnancy, they're talking about T-dap. So just like tell me a little bit more about this.
Yes. Well, if your audience doesn't know, I am a naturopathic doctor in British Columbia. And naturopathic doctors in British Columbia, our scope is to be able to administer vaccines. Our college allows us, just like pharmacists, from age 5 and over. It's not that I've chosen, but that's what I can vaccinate for children. A lot of parents ask, well, can you vaccinate my kiddos at 1? And I cannot, and nor can a pharmacist. Okay. So be it our college will change that. But anywho, at this point, it's just, that's when I can start. So with that means I've done a lot of learning around vaccinations, immunizations over the years. My journey to this started when I was living in Singapore, which has mandated vaccines. So parents had questions and I had no answers. I was green. I was new at a school. We had moved overseas and I just had a child. So I was getting a lot of parents with children and questions around vaccines. So since I didn't have any answers to some really good questions, I've had to do my own work and journey in understanding all of this. And it's always a moving target. It's not the same. It's changing. And around the globe, it's different. And even with the similar risk factors of contracting infections, it's different. Even within our own country, it's different. The vaccine schedule of British Columbia is different than Saskatchewan or Manitoba, Ontario. And even from the states to state is different. So to that is there is not one size that fits all. And every public health will have different ways of doing things. So to the T-dap vaccine, so you have your 3-in-1, so your tetanus, diphtheria, and pertussis, has been suggested for pregnant mothers probably more in the past 5 years, is because of that pertussis portion. So pertussis can cause a whooping cough. Okay. And by way of giving it to a mother, she will make antibodies, memory, to pass to that infant through the placenta before they're born. And then when they're born, they'll have some antibodies and mom will pass through her breast milk. So we have a protection to pertussis. Pertussis is one of the 4 top infections that sends infants into the NICU. So then the tool, the strategy in public health's eyes is to reduce hospital visits would be the vaccine. With that, though, are there any unintended consequences that come with that? So there was a paper that looked at efficacy with this in pregnant moms and to their babies. So what they did is they took, it's only one paper that I have found, but this paper looked at moms who had the vaccine, the T-dap vaccine, and moms who just had the TD vaccine, so minus the pertussis portion. And then the infants got their immunizations at 2, 4, 6 months. So they had their 5-in-1 vaccine or 6-in-1 vaccine. And they looked at the immunity or the creation of antibodies in those infants up to about 9 months. And what they noticed was the kiddos that were born to the moms who had the T-dap vaccine, their immunity decreased versus the infants who were born to the mom who did not have the T-dap vaccine, their antibody numbers increased. So the mother's antibodies were interfering with the infant's ability to make memory. So with that is knowing that knowledge is having a deeper conversation around, be it you won't know if you're breastfeeding or not when you're pregnant, but if you're breastfeeding and you plan to and do, and let's say it's baby number 2 or 3 and you've breastfed your first, so you probably will be able to, that your immunity will interfere with your infant's ability to make memory if you were to get it during pregnancy. I think it's important for the audience to understand too is that vaccines in pregnancy are category C. So when it comes to research, when you look at what you can give to pregnant moms, you look at category A, B, C, D. A and B, A is going to have the highest amount of research, meaning they've done safety testing in pregnancy on humans to know that that's safe. And B will be smaller human trials and mainly animal trials. But the C category is not going to have human trials. And D absolutely has no idea that it's safe in pregnancy. So vaccinations is category C. And on it is really to make the decision if there is a high risk of pertussis would outweigh the unknowing of the safety of the vaccine due to pertussis being an infection, a bacterial infection that may send that infant to the NICU. So there is a choice that needs to be made. But knowing if you potentially, the unfortunate part is as a pregnant mom, you cannot know if you have immunity to pertussis or not. So you can't make that decision based on your own immune status for your baby. Some moms have thought, well, perhaps I can get the vaccine after I've given birth, and that is an option. What I don't know, and I think we don't know, is the immune system changes for the pregnant mother postpartum. When you are pregnant, your immune system switches so that your body doesn't attack the fetus because it's a foreign identity. So it changes. And then when we give birth, we can switch back, and then we can make strong immunity again to what's in our surroundings. In pregnancy, we don't make strong immunity to things because that side of the immune system is turned off and quietened, because that would attack the infant or the fetus. So the decision would be it you get a vaccine postpartum, and then you'll mount immunity and then pass through your breast milk. If you're not breastfeeding, then you won't be passing any immunity, and whatever immunity you had during pregnancy would be passed to your baby, and then it's over. So those are decisions to be made too, in terms of if you're going to get the T-dap vaccine in pregnancy or not. Yeah.
Wow. And this is based off of the one article that you read. And do you imagine that we're going to be doing more research soon?
Well, I do not know. In terms of safety or not, a vaccine is deemed safe in phase 2 and then phase 3. Okay. And then once it's licensed, there's no more research that's done. So you go through 3 phases, and then once it's licensed, we're in phase 4. And we're in continuous phase 4. So for all the vaccines that we have on the childhood schedule is phase 4. And you'll see the post-surveillance reporting on a vaccine insert would be information that's collected on an annual basis, and it is to be updated, that insert. So we have updated information, because what happens in phase 4 is now the world has access to that vaccine. Now let's see how of all demographics and ages and health can handle this vaccine, and we are to, on an annual basis, have reporting and see if there's any changes or not, which were different from phase 2, which is human studies, and then phase 3 is just a larger human studies, and then put it on the market and it's licensed. And in Canada, we have a reporting system, and it's supposed to be looked at annually. And 2 changes that were made in the past was the rotavirus vaccine was pulled due to causing an increased rate of intussusception. And then basically it's your intestines go inside of themselves. It's a very serious condition. So there was the connection with the rotavirus vaccine doing that.
Sorry to interrupt. And how many years was it before that was noticed and then removed from that?
That I actually don't know. Okay. I don't know how that was, because I think that was pulled, in the 90s it was pulled, but then I think it was a few years that I don't know if they even changed the composition of the vaccine, but they put it back onto the market. And there's 2. One is a 2-dose and one's a 3-dose. And typically today in BC, we're doing the 3-dose, which means at 2, 4, 6 months. And then after that, it's not actually considered necessary or used. We do it up to 6 months and then we stop. So if an infant comes in and they're 10 months or 12 months old, the rotavirus is typically not suggested at that point. But the other vaccine that was pulled was the T-dap, the whole cell pertussis vaccine. That one was pulled and then put back on as acellular. So when you look at the letters, you'll see a lowercase a before the P, so it's acellular. They did that because it was creating so many adverse reactions.
Right.
So they pulled it and put it on. And with that, the adverse reactions decreased, but the effectiveness of the vaccine is not as good as it was when it was the whole cell vaccine. So I think the shelf life of that vaccine when we receive it is a lot shorter than we think it is, meaning when you get it, it is not going to be lasting for 6 to 10 years. It's going to be shorter than that.
So you'd have to make it
you should
more.
Then really it should be more often, really, if you want to sustain that. Now you can acquire pertussis naturally, obviously. I mean, it's still in our community, heavily in our community. Pertussis is. There was a paper that looked at 4 reasons as to why pertussis is still in our community. One is because the immunity wanes, so then you don't have immunity, so then you contract it and you present with pertussis. But another one was the fact, looking at when you're vaccinated from pertussis for the vaccine, you actually do spread it. So you have the ability to sustain and maintain pertussis in our environment. And they did a monkey trial, and they did it on children. So you yourself make immunity to that vaccine, but you yourself are spreading it. So then you're spreading it to someone who doesn't have immunity because it waned from your vaccine, and then now you contract it. And then if you are healthy enough, you should be able to handle it. But if you're not healthy enough, then you'll present with those symptoms. It looks like a common cold is what it looks like.
Does that happen for a lot of vaccines?
No, it doesn't.
Okay.
But this one, be it the details of looking at to why pertussis is still in our environment, this is a detail that they looked at and saw. I mean, other infections, we can see that it's not. For example, the chickenpox vaccine, we really have seen a major decline of that infection since the vaccine came in. So we know it's not spreading. It does have the potential ability to spread. That's part of the adverse reactions list that they list, is presenting with chickenpox post chickenpox vaccine. Same thing for the measles, mumps, and rubella, the MMR vaccine. You can present with that infection because they're live vaccines. And I think one case that I had a 10-month-old that I saw, we think that his chickenpox was due to being around 1-year-olds because it was the parents had no sign of reactivation, meaning shingles. And where else could he have possibly got this from? And he was 10 months, so he hadn't had the vaccine yet, diagnosed with chickenpox. And if you're diagnosed with chickenpox before you reach 12 months, you are not eligible for a chickenpox vaccine. It's the only one that states that, interestingly enough. But it does state in an asterisk on the bottom of the page to not give that vaccine if you have been. So that child was not eligible for the chickenpox vaccine at 12 months because they got it. Yeah.
So is that child then a super spreader?
Well, they stayed home. I mean, they stayed home and presented with the
Right.
chicken pox, and you stay home and you got the pox, and then you let it go, and meaning you just stay home and not go anywhere. But he would have a lot longer immunity, though, that child will, to chicken pox.
So he probably wouldn't then get shingles.
Well, shingles still can. So even if we've received chickenpox naturally, we still can present with shingles because shingles is reactivation of that virus. So it lives in us forever. Chickenpox is part of the herpes family. Herpes family is probably one of the nastiest viral families on the planet, in my opinion. No other viral family comes close to the herpes family. Okay. Adeno, rhino, coronavirus doesn't even match to the herpes family. And the herpes family includes your herpes simplex 1 and 2, your chickenpox, Epstein-Barr virus, which is mono. When we contract that infection, it stays in us forever. Once you got it, you never get rid of it. And it lives, so the varicella virus will live within your spinal cord, and then it'll come out, it'll follow what's called a dermatome. So you'll see usually shingles rash will just be like a line, and it really hurts. So it's following a dermatome is what it's doing. But if it follows a dermatome that's near your eyes, then that's where complications can happen. So usually we'll see it like the torso, under the armpit, you'll see people will be complaining of just just burning, hurting, but it's a line, and that's reactivation. So your immunity to that virus has declined. What's interesting with the chickenpox vaccine is there are countries that decided not to use that vaccine. For example, the UK, because they hypothesized that they would see an increase of shingles if they were to put that on the childhood vaccine. They offer it, but it's not on the regular childhood schedule. And today we see more shingles since the chickenpox vaccine has, so they were right. And with that is going to be because nature intended for us as adults to be reactivated by that chickenpox virus every 20 to 30 years. So because it's a childhood infection. So children who are 3, 5, 7, I got it when I was 12, get that virus. And then my parents would have been re-inoculated. So their immune system would have re-seen it again, made more immunity as a result. And then we're good for another 30 years. And then we become grandparents. And then our grandchildren present with it with another reminder. And so you make another mount, some more antibodies. So every 20, 30 years, nature intends that you would see that virus strain, and then you wouldn't present with shingles. Now, shingles in people who've still seen it naturally, they're going to be typically people who have tons of stress in their life. They do not take care of themselves. They don't sleep. They do not eat well. They drink, and then they present after a, be it you're in college and you're finishing your, be it board exams or what have you. You're a CEO and you're just, there's a lot of stress on you. And as soon as you relax, you present with shingles. But anything that you contract or you're around will be a more moderate, severe infection for you when you're not in good health anyway. Right. And so even when it comes to infections, I'm all about accountability. So if you are not taking care of yourself, you have no one to blame but yourself, and kind of in a blame time of blaming other people as to why we contract an infection. You are the reason that I contracted this. No, I'm not I might be the reason that you contracted it, but you are the reason that it is actually severe for you. So, which is it's a hard pill to swallow, because, we prefer to point the finger away from ourselves. And I think COVID really highlighted that in terms of accountability. And then easily want to blame other people as to why we contract something. If you're not wearing a mask or you don't get a vaccine, you're the reason that I'm not well.
Who's healthier than who?
Right.
I'm healthier than you.
Right. So it's, you have to take a step back and realize and look and judge your own life, how well you're taking care of yourself. Because it doesn't matter what it is, because there's only very few vaccines to all the infections that we can contract. Again, the adenovirus family, the coronavirus family, we have one vaccine for all the different strains, the herpes family, and then there's Lyme, there's tick-borne illnesses, there's foodborne illnesses. There's no vaccines for those. So how you're going to handle those? Well, it dictates really how hydrated and how well you take care of yourself really matters. So a vaccine isn't going to save you from all these things. And I think that's interesting. I have parents who are like, well, my kid's vaccinated. They're healthy. They're fine. They're not going to contract anything. And it's like, actually, we need to hold on for a minute. I need to explain to you that don't think that just because your kiddo is vaccinated, they can't contract other things. They can, and they will. And then what happens? How are you going to handle it? What are you going to do?
And how's the stress at home? Like, what's going on? The situation that they're in emotionally.
Oh, yes. It's big. How you, in your language matters around, I keep saying infection. The reason I keep saying infection, it's important. I'm not saying disease. I don't say measles disease, chickenpox disease. I call them all infections because that's exactly what they are. It might progress to an ailment, be it you have an ear infection, maybe meningitis, it progresses to. But just because you contracted Haemophilus influenza type B doesn't mean you're going to lead to meningitis or an ear infection. So there's a lot of fear around these infections as well. I think it's really important to be aware of their possibility, but not be fearful of them, because that's not healthy at all.
It's adding stress.
It's adding stress, which is immunosuppressive. We don't want to do those things because then we're suppressing our immune system. So I think being educated and aware of what those infections potentially can do for you then you can recognize the signs and symptoms better. I think it's really important to understand the signs and symptoms of meningitis specifically. I think that's the one line that parents don't want to cross and don't, of course, obviously, but there are a multitude of things that cause meningitis, and we have none that protect against any viral causes. We do for bacterial, but not for viral. So knowing those signs and symptoms, because what I've seen, I only have 2 cases, what I've seen is that when you present with some of these symptoms and you go to the ER, you usually triage and go home. Here's Tylenol for that headache of yours. Go home. But that could have been a very telltale sign that the beginning of of meningitis is a splitting headache. So, and there's things in children that be different than, or infants to children to adults that will present as meningitis. And I think it is, we need to do ourselves a service and know what those are. So, and that's not to also be like, is it meningitis every single time my kid has a headache? No, but it is, I think that the reason that deaths from meningitis even occur is because, unfortunately, when you get to the ER, they think it's just a headache and they're not doing the full testing. They can do orthopedic testing to know, not spinal tap, orthopedic testing. So movements of your neck and watching what your legs do to determine if this is a case of meningitis. But as we all know, in a hospital, if someone comes in bleeding or in a car accident and you're complaining of a headache, they're going to choose the person that came that's bleeding and lost a limb. So it's priority also at the hospital.
But if it's a viral infection, how are they going to treat it anyway? Because what you're saying is the bacterial infection is easier to treat.
Well, they'd still put you on antibiotics. Okay. But when you do a spinal tap, you'll be able to determine the difference if it is bacterial versus viral under a microscope, because bacteria is huge and virus is very, very tiny.
What about antibiotics on the system, though, for an infant?
Right. Well, if we're going to meningitis, I wouldn't play around. I would do antibiotics, certainly. And the reason you're going to do antibiotics, too, is you're going to reduce the load of other infections that are impeding the body to be able to handle that virus. Okay. So you're reducing that load. And then post that is going to be recovery, which means, yes, doing the things like probiotics and supporting the system to rebalance and come back. But because meningitis, there is going to be a point of no return, and we don't want to get to that point of no return. So that's where the interventions are really important and very helpful. Absolutely. And I would be, absolutely IV antibiotics.
Because we can recover.
We can recover.
We have all the tools.
We have all the tools.
And there's herbs too, and different dietary recommendations.
Absolutely. Yeah. There's fermented foods, there's spores, there's probiotics, you can heal the gut. There's a lot of things you can do for the system where in that acute decision making, antibiotics, and then we're going to fix you afterwards. And we can have best of both worlds is how I see it, and we can.
Okay, here's a question that's coming in, but what about reactions to vaccines? Some of them that we may not be able to recover from. And there's also this topic, we may have time today to kind of scratch the surface around autism and certain vaccines maybe being the cause of autism. What I'm seeing on your page is that you don't believe in that. Okay, so
yes.
Yeah, let's explore.
Vaccines don't cause autism. And that's going to make, for some people, a ripple sensation in their body when I say that. And I know that. Yeah. So I had the opportunity to give an hour lecture, 45 minutes, at MAPS, which is the Medical Academy of Pediatric Special Needs. It's the largest conference, I would say, in the world that medical doctors, nurse practitioners, naturopathic doctors come together and other healthcare practitioners to support children who display neurological deficits, from PANDAS to PANS to autism to ADHD, you name it. This is the conference to go to. So being in the world of vaccines, being in the world of autism, I really have tried to set the record straight. As one person, am I going to do it? Probably not, but I have to try some way here. I think that we are seeing when I look at an adverse reaction report, and on there states encephalitis, encephalopathy, to me then is, okay, how could that happen? Why is that happening? If it's on the list, it's a possibility. And let's say a child presents then with encephalitis. If that's not managed or taken care of, Now we have chronic neural inflammation. Now we have a kiddo, be it they're having seizures, be it they're not making eye contact, be it speech is gone, be it there's toe walking, be the insult on the brain has caused a problem. And they are stating that encephalitis is a possibility. So to me, is when you have a child that presents with possible low-grade encephalitis, chronic, that's not dealt with properly, then we move into this area of what looks like autism, but it's not. It is neural inflammation, but we're calling it autism. And I think we've done ourselves disservice by doing that, because when you label a child autistic, really the door has closed, because now we are part of being neurodiverse. And so be it we're going to do OT, ABA, you're going to get an EA at school, and those are how we're going to help your kiddo, versus looking, be it at the pathophysiology of what happened. There is autism and Asperger's, an autism spectrum disorder. So you have one end, be it it's autism, Asperger's isn't used anymore. We are neurodiverse, but we don't need any help. We can speak, we're not making eye contact, we're looking away so that we can focus, but we can still be in the world. We can be part of the world. We can do all the things, and we're a bit quirky, and we don't understand your sense of humor. Fine. You're still in the world, and you're capable, and you can live life to its fullest. On the other end, we have children whom do have to wear a helmet because they're hitting their head against the wall. They are having seizures. They cannot speak. There are motor deficits with them. To me, that's not autism. And I will never call that autism or celebrate that either. To me, means something happened, be it a vaccine or not. Maybe it was something else. It could have been a natural infection. It could have been antibiotics paired with Tylenol several times in the first year of life. And then they got a vaccine. It's just this perfect storm.
The environment, going back to the environment.
The environment. And you're going to put gas in a diesel car. Don't expect it to work well. So this is what I think that we're dealing with. And this is where the language matters. Vaccines don't cause autism. Based on the list, they have the potential to cause encephalitis. And if we label it that way, then we're going to discover, be it treatments, because we're calling it something that begs for a treatment or an intervention. And then if we were to do an intervention, would that kid go back to the way that they once were? So when you hear people recover their children from autism, they didn't recover from autism. They recovered from neural inflammation that, looked and spoke and looked like autism, or we want to call it that because we don't really know what to say. To me is, let's call that encephalitis as it is, support them, treat them, and then now we're back to square one again. And that's what my big speech is about, and looking at the mechanisms of action. There's 4 main ones that I look at in that lecture. And the audience is like, okay, we have something tangible to deal with too.
We have something
ideas
to repair.
Yes, something to repair.
We see some things in this conflict, and we can then repair it and focus on healing it so it doesn't reoccur.
Right. And saying that vaccines cause autism has grossly backfired, because it also isn't autism, and leave autism as to what autism truly is, and those whom do have autism, leave it in that, call it something different. And that's where my mission now is to change the framework around this and look at this differently. And if you're going to have an adverse report stating certain possible adverse reactions, then let's look at the mechanisms that which could cause that. And then we can prevent them, or we can fix it, have a solution to that. Yeah.
Beautiful.
Yeah.
And there are easy ways to treat it, right?
Well, it depends. It would depend when this happened and how long it's been. Usually children, let's say that they're developing really well, and then we see a transition and a change in our children. And now it's been 6 years, potentially still within 6 to 8 years of when you saw a decline in their milestone development. I think that we still have time for recovery. But if we've hit teenage and beyond, it becomes very difficult because things are set and they are how they are. But that recovery and rebuilding, there are for some children, there are things that parents have done that they've noticed gains. We're not going to get right back to where we were, but certainly gains, meaning be it seizures have reduced, or they're starting to say words, or eye contact is better. They're speaking, but now they're seeing the world a little bit differently, because they have the intellect is coming in, and be it they're neural firing in the brain. They're having those connections now, because be it we're removing inflammation that's interfering with that. So then they can communicate a little bit better. But there is a window of time that I think we can heal the body, and then we're outside of that window. Yeah. Yeah.
So in knowing that certain vaccines can cause encephalitis, swelling of the brain, then that's something to consider as a parent wanting to or not wanting to immunize your child. And I really appreciate you sharing that information, right? So offering this informed choice, knowing that these are the risks, what would you say to parents who are thinking about childhood immunizations, but they want to do, say, the minimum, or just try and not vaccinate their child at all?
Yeah, everyone's journey is different. And I think it's important that for me, informed consent, I think, looks different than a lot of healthcare practitioners. I want my parents to be fully informed before they consent. And when we look at the BC CDC adverse reporting, it's 3 pages, and you should be aware that it exists. And just because it's there doesn't mean that is going to happen, but that is important for them to know. Because with that is, if you as a parent recognize that one of those adverse reactions are occurring, you let one of us know to report it.
And we treat it.
And then we support your child as a result. There's a lot of missed data that happens, because I think those that are part of administering vaccines, be it aren't aware of the possibility of these adverse reactions, don't know what to do if they see it. A lot of times it's just the triage is Tylenol. That's the treatment. Wow. Which would be the last thing that I would do in that moment at all, because be it the child is presenting with pain, or they're not sleeping, or whatever it may be, or maybe they're presenting with diarrhea. So we're just gonna treat that symptom rather than be it the cause of that which is happening in the body, and that's going to be inflammation that's happening. So we need to quell that, but not via Tylenol. So with parents that I work with, what's really important, first off, I think, is for you to understand the infection itself. Do you understand the infection? And if you have any, some people choose the vaccines that they choose for their children just because of their personal relationship with that infection. So I've had parents who are like, my chicken pox was horrendous. I was so uncomfortable. Therefore, I'm going to do the chickenpox vaccine for my child. Okay, that's how you're going to make your decision. That's how you're going to make your decision. To those that are, knowing someone that maybe has passed from meningitis, then they're going to, I want the meningitis vaccine, which would be your MinC vaccine. So it's that relationship, it's that understanding, it's the because vaccines are a tool. They're a tool to provide your body to make antibodies before you see that antigen in the world, whenever that time will be. We never know when that's going to be. So that's why it's classified as preventative medicine, because you're going to make antibodies. So that's the first part is that piece. And then we talk about vaccines themselves. Yeah.
And so parents can come to you after maybe listening to your webinar, because I know you have a webinar. That's where I'm sending all my clients.
Awesome.
Her webinar series is going to give you the information that you need to have this informed consent.
Yeah, it really, what the webinar's point, because there's 8 of them.
Right, because there's a lot of infections to learn about. Right?
And so I've split it into, webinar 3 is just viruses, and webinar 4 is just bacteria. So it's an hour on each of those, because they're different things. So understand those infections, their possibility of what they could cause on the body, be it it's an ear infection or it's meningitis, whatever that may be. And then once you understand that, then be it we can move outside of that and move away from that, and now understanding the tool, which is a vaccine. And so what's in a vaccine? What is aluminum? How does it work on the body? And then my first webinar is on infant immunity, because I think it's very important to understand how the infant immune system works, because that's part of a decision making. And the reason that vaccines are brought in at 2, 4, 6 months to me is important. The history to that. The second one is when you're pregnant and breastfeeding. The fifth one is around aluminum and genetics. And people think because I have MTHFR, I can't get vaccinated, which isn't true either. We really also shot ourselves in the foot to pin MTHFR, because then we've missed all these other SNPs that are very important in the conversation of vaccines. MTHFR has nothing to do with it. Nothing to do with it in terms of you can or can't detox or make immunity. It plays zero role. It's other ones that are very important that we need to talk about and discuss. So it's more about inflammation, and if you can make immunity, those are important. And then I speak on the safety, efficacy, and research in the sixth one. The seventh one is my most favorite. It's not as heavy as the rest, but how do we help our kiddos thrive? What do we do? On the generalities, right? From food, nutrition, sleep, how much do they need, gut health, which is very important. And then the eighth one, I talk about vaccine optimization and what that looks like. And so questions to ask your provider, to my what I use pre and post. No dosages are on there, but what I use pre and post vaccine and why I use those things.
What do you mean? What do you use? Like
so I'll use
foods or
nutraceuticals. So I'll use from probiotics, vitamin D, glutathione, and I do specific homeopathics. I don't.
Wow, sorry. So you're supporting their system as they're getting these inoculations. You're like, okay, your body's about to receive these inoculations, and we have this protocol here to help you through this.
Yes, because there's research around, like, for example, vitamin C. The lack of vitamin C has shown children can present with shaken baby syndrome after a vaccine. So, and the reason behind that is going to be because of the rise of histamine, and vitamin C is an antihistamine. So it's a mast cell stabilizer. So I want to use vitamin C pre-vaccine, because we're going to get, also we start pre, so we get our load up, and so we can know that the child's body can handle these things, because you wouldn't start these on the day you get a vaccine. And which one created a problem? Was it the supplements, or was it the vaccine? So we do it 2 weeks beforehand. We know that your body is just fine with those things. Then we get the vaccine, and then we continue afterwards as well. Glutathione has been shown that it helps our innate system phagocytose. So you have all these innate cells, macrophages, dendritic cells, neutrophils. And glutathione helps with that process of eating that infection, which means the antigen from your vaccine, they eat that, they get called to come to that site, and then they present it to a B and T cell to kill it and make memory. So both sides of the immune system need to be in operation, meaning you can find and kill or eat it, and then you need to be able to make immunity to that too, is the second more important side. But glutathione specifically is for that. And it's an antioxidant.
I was just going to say, a lot of people have been using it when they're sick, like adults.
Yeah, glutathione is a great antioxidant, really important for the lungs. So the thing with glutathione and Tylenol can wipe the body's glutathione storages. And there's papers looking at overuse of Tylenol leading to asthma. Is one problem with Tylenol. The other reason is Tylenol for some bodies. It's a glutathione-dependent pathway to break down Tylenol, acetaminophen. And if you cannot break it down properly, you will have a metabolite that is very neurotoxic. So that metabolite will also find its way to the brain and add to neural inflammation as well. So one takeaway from this is we do not do Tylenol pre, absolutely not, and we definitely don't do it post. If your kiddo is having fever, we would go to homeopathy first, and then we would go to something like Advil if need. We don't touch Tylenol if we can help it. If we do, at least we have glutathione on board. You already have it as part of your pre-post.
And what about herbals, though? Like trying to the body manage the fever, so things like a yarrow bath or using different medicines.
Oh yeah, you could do absolutely a bath with your kiddo as well. I don't use herbs post-vaccine? Is it going to affect immune response?
We just don't know.
Is what I don't know. I know the nutraceuticals do not at all. They support, they don't modulate so that your body doesn't make immunity to that at all. They don't intervene in the process. But something topical in a bath, lukewarm, those other ways of managing that fever are certainly very important. Yeah, absolutely.
Amazing. So we have like 5 more minutes.
Okay.
Is there anything else you feel like it's really important for parents to know, pregnant families to know?
I think it's really important for you to know that vaccination is your choice. It's a recommendation. It's not a mandate. And you have the right to your questions being answered. In order to achieve informed consent is a 7-part process laid out by the BCCDC. And one of those is the opportunity to ask questions. And to me, I take that very seriously. That's why it's an hour that we have a discussion. To public health, it might mean 5 minutes to them or a handout. To me, that's not good enough. To some, they think more information means hesitancy. And I will always disagree with you. I think shaming and gaslighting is the reason for hesitancy. And I think public health is starting to understand that. I think they're starting to change the way they say things and their language and how pushy they can be. They have a long way to go because in my office, I get those patients who have been yelled at and thrown out of the pediatrician's office or public health for asking very simple questions. And they never came back because they were traumatized by that. And they're in my office. And they're paying to tell me these problems. They're not making them up. This isn't a situation of malingering. This is because they actually had the situation and they paused and was like, I have no idea what to do and therefore I'm not doing anything. And now I have a 5-year-old coming into my office who's never been vaccinated because of their situation that they were faced with their healthcare provider. So language matters, how we say it, our tone. What we don't say matters as well, because if I think you're withholding something, then now I'm going to be questioning you even more. So honesty goes a long way and transparency goes even further. To parents, you have a right to know. Find someone that will answer your questions. And if you want, dig if you want more. If you don't feel satisfied, then keep going until you're satisfied. For me, I do not care what choice my patients make. I don't care. I couldn't sleep at night if I cared. What I care is that you are fully informed. That's what I care about. I never want anyone to come back in my office and say, you never told me this. To me, that would be gut-wrenching of like, I'm sorry, or I didn't know it, but I try to give all information so that you can make informed decision. A lot of my patients vaccinate, and there's a lot that don't. There's a mixed bag as to what they want to do and decide to do, but it is a journey, and it's a fair journey to take to make a decision for your children. It's your child. It's your decision. It's no one else should make that for you except the parent, and you should be informed. Mm-hmm.
Thank you. Yes. And then taking them responsibility for their health and their child's health.
Yes.
Dr. Taylor Bean, you're so amazing.
Oh, thank you for having me. This is awesome. Yes.
And I'll be linking in the show notes more information on how you can get in touch with Taylor. Again, thank you.
Awesome. My pleasure.
Talk to you soon.
Okay.